The Ministry of Environment, Climate Change and Forestry, together with stakeholders in the industry, has launched 2 air monitoring sites in Nairobi. The sites, located at the Mama Lucy Kibaki Hospital and the Nairobi Fire Station along Tom Mboya Street, are designed to provide critical data on air quality in Nairobi. Environment experts hope that this initiative will help Nairobi County better understand the variations of pollutants resulting from waste burning and public transport. Health practitioners have sounded the alarm over a spike in respiratory illnesses, which they attribute to air pollution. Mary Moki has more.
This is a typical day in the streets of Nairobi. Vehicular and human traffic jostling for space in the crowded streets that are thick with exhaust fumes. Those outside the busy city are not spared from the toxic fumes. Smoke billowing from trash burning is a common feature in most residential areas. Experts now warning that Nairobi is choking under air pollution. The clean air quality in the city is at 15% against the recommended 5% by the WHO. On Friday, the government, in conjunction with Nairobi City County, the United States Agency for International Development, and the World Resources Institute, launched air quality monitoring sites in Nairobi to help combat air pollution.
For breathable particles, the WHO recommends 5 microgram per meter cubed. What we saw there was 20. What we are seeing in the fire station is 70. So this one is 4 times above the recommendation. The one at fire station is probably 14 times above the recommendation. So our air is already quite bad, and we need to see how do we start reversing that trend.
Today we are here to demonstrate commitment to change. The establishment of these regulatory air quality monitoring sites represents a critical step in our mission to improve the quality of life for Nairobi residents by providing accurate, real-time data on air quality.
The first site is at the fire station along Tom Mboya Street, which is aimed at monitoring air quality around the CBD. Data suggest vehicular pollution, which stands at 40%, is a leading cause of poor air quality in the city.
The 2 major sources of air pollution in most urban areas are transportation and fuel combustion by stationary sources. However, motor vehicle emission seems to be the dominant source of air pollutants. NEMA is going to gazette vehicular emission testing as we roll out air quality regulation this year.
Started this work of air quality in Nairobi. We actually thought, like any other city, vehicles are the biggest causes. The equipment we have there is measuring that breathable particulate matter.
The second site, which is Mama Lucy Kibaki Hospital, was arrived upon due to the alarming number of patients from that area who seek medical care for respiratory illnesses. Mama Lucy Hospital CEO Martin Wafula says the facility has noted a worrying increase in premature births, a factor directly attributed to the poor air quality in the area.
We've also started receiving cases of respiratory cancers, the cancers of the esophagus, the cancers of the airway, the cancers of the lungs. We have also observed a lot of premature deaths for the preterms, and we're also getting quite a number of mothers delivering prematurely. In a day when we deliver around 70 mothers, we don't miss 20 prematures. And reasons being that if the quality of the air that the mother breathes is affected, then definitely the health of the pregnancy is affected. Then additional to that, we have also observing a lot of respiratory distress in pediatrics.
The air monitoring sites will focus on particulate matter and black carbon, which experts say is inhaled through the lungs and directly enters the bloodstream, causing respiratory and cardiovascular diseases. The equipment is able to monitor the core chemical composition of these particles and isolate sources, that is, if they are from vehicle exhaust fumes, wood burning, or chemicals from industries, which will in turn inform policy and regulation. Mary Moki, Citizen TV.